Hello everyone and welcome back to MediInsights, where we simplify medicines for better care. Today we explain Aztreonam Injection, a targeted antibiotic for serious gram-negative infections, how it works, recommended dosing, possible side effects, and practical safety tips you need to know before, during, and after therapy right now quickly. To start, here's why someone might be prescribed this drug. Aztreonam is a Monobactam antibiotic, mainly used to treat infections caused by susceptible gram-negative bacteria, including urinary tract infections, lower respiratory tract infections, intra-abdominal infections, skin and soft tissue infections, and sepsis. You may see it used when other antibiotics are unsuitable, and it is sometimes chosen for Pseudomonas infections or as an alternative in patients with many penicillin allergies. Now let's talk about the dose and how often to use it. For most adults, the usual dose ranges from 500 milligrams to 2 grams given intravenously or intramuscularly every 8 to 12 hours, depending on infection and severity. For severe or life-threatening infections, higher dosing, such as 2 grams every 6 to 8 hours, may be used, with common maximum daily dose around 8 grams in critical cases. Pediatric dosing is weight-based, and the dose and interval change by age and indication, and dose adjustments are required for renal impairment. Always follow the exact regimen your prescriber orders. Next, a simple look at what this drug does once you take it. Aztreonam works by binding to penicillin-binding proteins, especially PBP3, which inhibits bacterial cell wall synthesis and leads to bacterial cell death. Because it is a monocyclic β-lactam, a Monobactam, its spectrum is focused on aerobic gram-negative organisms, and it usually has low cross-reactivity with many other beta-lactams. This targeted action is why it's chosen for gram-negative infections. Keep in mind it may cause unwanted effects in certain people. The most common effects you may notice are pain, redness, or irritation at the injection site, gastrointestinal symptoms like nausea, vomiting or diarrhea, and skin rash. Less commonly, you might see phlebitis, allergic reactions, or antibiotic-associated colitis. Serious allergic reactions are rare but possible, and there is a small risk of Clostridioides difficile infection with any broad-spectrum antibiotic. If you experience severe rash, difficulty breathing, high fever, or bloody diarrhea, seek medical help right away. Before you go, here are some key safety points and tips. Tell your clinician about any drug allergies, especially to ceftazidime, because cross-reactivity may occur with that specific agent. And mention kidney problems, since doses must be adjusted if your renal function is reduced. Do not expect Aztreonam to work for viral or many gram-positive or anaerobic infections, so take it only when prescribed. Complete the full course unless instructed otherwise. Report persistent diarrhea or signs of allergy, and consult your healthcare team about pregnancy, breastfeeding, or other medications you take. For cystic fibrosis, lung disease, an inhaled formulation exists but is specific to that indication. Thanks for watching. If this breakdown helped you, please subscribe to MediInsights for clear, evidence-based medication guides, and leave a comment with your questions or topics you want next. Stay safe and talk to your healthcare team for personalized advice.